providing information for families on why they're adding that to their curriculum or part of their program, and then what they can do at home to continue that physical activity learning.
Ditto. That's exactly what I was thinking too. Really focusing on being inclusive.
I think a third piece of that family engagement part, though, is also expectations a family can have towards their providers. So not only should our providers be offering the activities and encouraging it at home, but families should go into programs with a higher expectation of physical activity by being knowledgeable about what should be going on there.
So Lori, like you're saying, if a family's out looking for childcare, these are one of the things that they want to ask for and look for.
Agreed.
I think everybody hit the nail on the head. So but we are saying like our target audience is more those who are caring for the children 0 to 5, and like you said, promoting family engagement. Not so much maybe the professionals that are, providing that training and assistance for childcare providers to get where they need to be. We're kind of looking at kind of the other side of it. Just I want to make sure my own understanding is correct.
But I think that, sorry, go ahead, Rhonda.
Oh, sorry. Yeah, thank you. Yeah, Tara, I think that you bring up a really good point. I think that is addressed in another strategy that we have when we determine what our best practices are in our geographic area. So that I think that tool could be used with those that provide technical assistance to the providers. That's kind of what I was thinking. So that is definitely a very important piece, but I think that falls into that part about what we determine as being best practices, because there's so many resources that are out there. So if we identify those, I think that would help steer the technical assistant coaches.
I think that's a really good point. Yes. Okay. Thank you.
And I also think, Rhonda, on the flip side of that, we have Family Conservancy that's providing that. Both Missouri and Kansas are doing PALS, which focuses on physical activity. So to me, I really just want to hit providers every which direction we can, and here's the importance of it. Again, Missouri and Kansas were involved in Go Knapsack. So just kind of bringing it full circle and just pounding it in their heads.
And if I remember, gosh, it was a while ago, probably 2 years ago, but when we had that small group of leaders come together, that's when Emily was still here. One of the takeaways that I remember them talking about, and Lori, I know you were on that project as well, was that center directors were talking about professional development that came from experts. And so thinking about whether that's a doctor or whether that's a nurse practitioner or whether that is, someone that does PTOT for young children, I think that's somewhere else that we can look into that professional development piece, but being more that it's coming from more of the medical experts was something that really resonated from that group. Lori, what were you going to say?
My piece was just back on where you were talking about I can't even think. But yes, professional development is another area that we're aiming to look at. So I think when Tara was talking about that piece, that's going to tie more into our best practice. That's what you were talking about, Rhonda. Best practices, and that will lead into our professional development. So
absolutely,
I feel that piece is over there as opposed to here, even though none of them are unique and only by themselves.
Yep.
So if we came up with our purpose statement for this group, and again, this can be for the short term, because one might assume that after a year or so, and maybe even shorter, we will have completed our primary purpose, and then we could move on to identifying resources for like the next one, because both Tara and Rhonda and Lori brought up a couple of other targets for resources. How would you summarize the primary purpose of this group right now? So it sounds like we've already identified this is for providers of services for birth to 5 years. So we're encompassing family-based home provider, home providers, center providers, anyone else who considers themselves part of that group.
I'm anxiously waiting to see what Rhonda's putting in the chat. Hopefully she has just it all taken care of for us. I think we also, when you look at 0 to 5 programs, because we've had PAT on this, conversation, I think they would be part of that, providing resources out to the families that they're working with, Head Start, preschools. I mean, it's all right. And I know Head Start in Kansas are licensed as centers, but I know they're a beast in and of itself. See, I knew Rhonda would have something.
Thanks for your encouragement. It's very vague, but I just put to identify intentional resources for providers and families to promote physical activity in children birth to 5 years of age.
Do we want to include what target area we're talking about? So the Kansas City area or something like that?
Great idea. Yep. So maybe like after families, add in our 6-county area and our targeted.
When you say KC Metro, I mean, not since I'm not from, what does that conjure up for people? I mean, would that capture it?
Well, so everybody's a
Good
bit
question.
different.
Yeah.
There's
Mhm.
4
Okay.
counties, 6 counties, 7 counties,
Mhm.
9 counties. And so for the physical activity plan, we are targeting 6 counties. So I think making that clear
Yeah.
is helpful. And that we weren't doing that to exclude any counties in the metro. We were doing it to sort of align our efforts and engage partners that are in the area. Well, let me back up for a second. We're really trying to align with the hospital's priority areas. And so when they do the community health needs assessment, it really does align with what we're doing. We currently have one additional county than the hospital's health needs assessment has. But the other county would be the next one they would add. Cass is it, Rhonda? So over 80% of our 80% of our patient encounters come from this 6-county service area. So that's how we've identified it. We've also noticed that we have partners with the Kansas City Healthy Lifestyles Collaborative that cover those counties, some more so than others, and some in different sectors than others. So like this sector has Clay and Platte participants on a regular basis. So Clay, Platte, Jackson, Johnson and Wyandotte. We don't have Cass as much, but anyway, I'm sort of rambling about why we have those 6 counties.
No, I totally understand. I mean, in Wichita, about Wichita area. So what does that include?
Yeah.
So Rhonda, are you thinking that after for providers and families and then just list those 6 counties to promote physical activity in children birth to 5 years of age?
Is that what you were thinking, Lori?
To be
To
really
identify?
clear?
That sounds great. I just thought we may want to include that.
Yeah.
Yeah, well, I think it needs to be so, but it makes for a long statement, but I think you do need to clarify. Because even if you put 6-county area, people are going to go, what 6 counties? So.
Yeah.
So would we want to further clarify, however it is that Children's Mercy does, like, call that area? Like, do you have a specific name for that 6-county target area and then list them out? There's no, okay. Sometimes you have like a an actual name for something. So,
Yeah, they haven't.
okay.
Because we consider ourselves a regional health system. But, 80% of the patient encounters still come from a local
Sure.
area, if that makes sense. I don't think I think we're fine with leaving it like this. So as an example, what would be some of the top resources you think would be most helpful for providers to promote physical activity?
I think one of the top things that we should be promoting would be the toolkit for the Fitastic.
The early childhood toolkit?
Yeah, because Lori, that probably includes development appropriate activities, milestones, what they should be doing. I'm also thinking, well, go knapsack materials, but we'd have to figure out how to do that because there's a lot within the physical activity, outdoor play that talks about the length of time that kiddos need physical activity during a day, during a week. To me, any outdoor any outdoor play kind of materials. Rhonda, and Lori, when you guys met with that group, and I remember that, yeah, pals, move smart. It wasn't identified specific resources that were needed at that point, correct? Was it?
It might not have been part of that group, but I know that Emily had started. Well, she did a walk by. Oh, or not a walk by, a walk. What's it called?
Crosswalk.
Yeah, thank you. Crosswalk. Of all the different best practices in different programs. So like looking at Head Start, looking at licensing standards, looking at NACI, all of those. But we also started a collective list, looking at Nemours best practices, looking at, any of the work that we did with the program with Chris, all those best practices and really where those all compiled from. So I think it was also listing all of those. And kind of, looking toward what you guys are utilizing for your links to quality, like, what are your go-to tools for best practices?
I think
Yep.
this is where Amy could really be a benefit, and Joanna. I think in Amy, because as I put in there, she has shifted from working for one project to help to stand up their family childcare network, and that's in the KC on the Kansas side. But she would have a group of providers that she could ask what was needed, what's the current practice. The same could be done in our CCQIS learning communities. I continue to wonder how we can engage those programs, and again, on the Kansas side, because that's what I know, that are involved in the Start Young. They're all child care centers at this point, but they're all in Wyandotte County, which looks at a specific demographic of families and programs. I know they're moving towards engaging family childcare in that, but they're not there yet.
Well, that's what I was going to say, Chris. They have actually reached out and are doing some childcare homes too.
Yeah,
recently.
a few of them.
Yeah.
But that is a target group. I just think of trying to engage or find out, ask that instead of us kind of going, well, what do you need?
And Rhonda, this is the list that you were talking about, right? That had been created a few years ago. I assume you all can see the screen that's being shared in the Google document for early childhood resources. Does this look familiar to most of you?
Yes, it does. And yes, we can see it. Is there any way that that can be shared some way other than through Google Docs though? Because UG doesn't like us enough to let us access Google Docs that way.
Well, we have the same problem, so we all have to access it through our personal stuff. But we can certainly find another way to do this. I mean, we are absolutely happy to share this spreadsheet as a spreadsheet. And then as you all identify additional resources, you're welcome to just send those resources to us. We'll update the spreadsheet and can continue sharing it after each of these meetings so you all have an updated copy. If
we continue to use Teams, we can create a Teams channel, but I don't think everybody in all agencies
Great idea.
can utilize Teams.
yeah,
That's what
and
we use all the dang time.
We do too.
do you have any trouble with people outside your organization accessing shared files in Teams?
We have problems with people not kind of like the Google Docs. I don't even think that Region 4 can utilize Teams, and I'm not sure why. It's a Microsoft platform, but we are trying to build another statewide project communication platform in Teams, and some people just, and I don't know the reason, couldn't access it. So we'd have to check with Amy and whomever else is on, but I'd say if everybody, to me, I think if everybody can access Teams and utilize it, we could just build a Teams channel and put files in that and avoid a Google Doc, because I'm with Lori. I mean, I can access it, we can use it, I don't like it, but that's just me and my set ways.
Well, we can see what our options are. My experience has been when we try to do that and give people outside Children's Mercy access to a team that we set up, there are all kinds of challenges with that from our IT's perspective. So they may have put things in place that don't, I mean, even though in Teams you can restrict access to a specific team and channel and files, it's
Yeah.
still,
Those IT people get a little wonky about security.
Well, especially at a children's hospital. I mean, hospitals are a target already. Children's hospitals are an even higher target because if you can get social security numbers of kids, people aren't going to notice it for 18 plus years.
Yeah. We also have access for our regional offices through a SharePoint, but again, we have some regional offices that can't access it for whatever barriers through their IT or programs they use.
We'll keep working on that. For the short term, we'll send out this spreadsheet as a spreadsheet. So we may just download it as an Excel file and then send it as an Excel file. That way it's not a Google sheet that you still have problems accessing. And we'll start there and then we'll continue working on, are there better ways that we can update a document at the same time versus just sharing the resource.
So
but we'll certainly do that.
Sorry, Shelley, we probably need to go through, I don't know if somebody already has or not, and make sure all of these links that we do have as resources are still current and correct and not broken and all that. So that's usually a first priority.
I think I've done that. And some of them were just like the old version of a guidelines book or something. So I think I put the new ones in, but even as I was looking at today before this meeting, there were two that I opened that weren't right again. So I had to go find them.
Can we, sorry, I'm just getting down to the details and maybe being anal, but when you copy this over to an Excel, can you add like another sheet that's around like family? So we can keep, since our two target areas are providers and then the other is families.
Okay.
And what do you think about having a separate purpose statement for each one?
I like them together because I think it shows the partnership.
Yeah.
Do you
Or
think
in-
the
in
same
Lori's
resource
visual.
would be helpful for the provider and the family?
No, I see them different, but
Okay,
I see some overlap.
okay.
I might download that, Rhonda, and send it to you because I might not know the difference for which one goes on which spreadsheet.
Oh, sure. Yeah.
Okay.
Another option, Rhonda, and tell me if you think this is well, for all of you, is this too confusing? You could add a column to that sheet that has, I can't think of a better term right now, but audience, and then you would either put provider or family.
Yeah. That's absolutely great.
Okay.
I like that option. I was either thinking that or just in the resource type, just designating it there, but I
Sure.
like the addition.
That way you could sort it either way. You could sort it by resource type, you could sort it by audience, you could sort it by another feature, but I think if they're all on the same page, then you won't have to toggle back and forth to see, did we already identify this? Did we
Sure.
not? You can just sort the one document. And then this document would be our guide to how we organize the resources on the web page, on the website. So on our website, under the early childhood sector, we would probably separate them under provider and then family. And we'd list the resources under those two headings in alphabetical order, if that makes sense.
Yep. And I was also going to add, I think maybe this would be an opportunity as we talked about the group of leaders that we engaged with a few years ago. And then also the suggestion of starting a relationship with the Start Young participants. Once we've identified our list for providers, I'd really like providers' feedback. Especially just with my experience, as a former director as well as technical assistance coach, like caring for our children is often referenced for a great resource. I know I personally never used it. It was daunting. It's huge. So I want to build this with them, not build it for them. And I just think that would be a way to maybe engage and just say, here's a list that we came up with and tell us like, what's your 3 go-to? I mean, it could be any question that we want to get, but we have the Links Equality folks. We have people that Lisa Farmer's working with. I keep calling her Lisa Farmer, but I know she has another last name.
Louder. I
I
do the same thing.
the relationship that Tara has with programs as well as Lori, Chris. I don't know. What do you guys think about that? Doesn't have to be long or daunting or anything, but
I really like seeking the provider feedback. I think that's will be crucial. I like personally, like from my perspective, again, everybody's is different. I like the idea of keeping caring for our children on there because it is long, but it is free. They can download the free PDF online. And you can easily search within that. So I like that. But then I've also found that as we're revising like the Move Smart workbook and as our CCHCs have been taking trainings from Nemours in activity and nutrition, it seems like everybody's pulling from caring for our children. So it also seems like a national, consistent best practice as
Yeah.
that's updated. I don't know when they'll eventually, publish like a new edition, because I know it's been a bit. But anyway, that's my 2
yeah,
cents.
that's a good point too. That some people may be using it and I just don't know.
But you're absolutely right. It is daunting. It is.
But it sounds like there's some good tools to be able to use it more successfully now than when I did.
I think so. You can search online easier too. And
That's
there's
good.
there's a lot of appendices on the newest version too. So I always tell the CCHCs like you don't even have to create the resource. You can just, pull that PDF out and go.
So nice.
So, but
That's
anyway.
great. Thanks for sharing that.
Yeah, Rhonda, I'm
could
with you, but now that it's an online and searchable, it's totally different than having to pull out that cumbersome. But I think it also provides a level of another level of research base and letting providers know and families know
Yeah.
that there is somewhat of a, yeah, there you go. I was gonna say, yep, mine's right over there.
Yeah.
Yeah,
Mine's in
somewhat
my
of a Bible
closet.
that, we're looking at, we're following best practices,
Yeah.
research based, all that stuff.
True. Good points. Good discussion.
We can always add a column again to the spreadsheet for notes where
Yeah.
comments like this could be helpful for people as they look at the resource. And these could be things that could then be translated onto the website in terms of a description of the resource. We could also, if it's helpful, and we don't have to do this now, but we can always add additional columns in here as they become helpful or as we start working with it. So if we were to get feedback from providers, we can include that in here, approved by providers. If we want to do something like that, we could put a comment in there that it was reviewed as of 2023. So we make sure that we're reviewing these on a regular basis. Again, I love top choice of providers. I think that would be a really nice little, I don't know, recognition star. I don't know. But anyway, I think this is a great start. So we have a purpose statement. We know what we're doing. We have a list of resources we can get started with. Our next steps can be, so number one, schedule our next meeting. Number two, we would invite additional people to participate. We can specifically request Amy's participation, and Chris and Rhonda, if you want us to reach out to, is it Joelle? Who's looking at the name?
It's Joanna, and
Joanna?
I could reach out to her. Yeah.
Okay, that'd be
I mean,
great.
I
Feel
already
free to
have
copy
and
us.
asked her if she would participate. I'll just do another follow-up and make sure she's gotten registered.
Okay, and feel free to copy us on that, and that way we can send her any additional information that would be helpful. Okay, so number one, next meeting. Number two, invite new people. So we'll invite Amy, Chris, you'll invite Joanna, any of the rest of you. Once we schedule the meeting invitation, feel free to forward to others are interested in participating. And then we'll send out notes and the resource spreadsheet. So anyone who wasn't able to attend can see the notes and the recording if they want to. And then at the next meeting, we can begin the work of reviewing the resources that are already on there, identifying additional resources, and then also potentially talking about how we might get feedback from providers that these are the resources that make the most sense for them. I mean, one of the things I think about is how do we do something similar to what we did? And Rhonda, I hate to say this is probably over 5 years ago that we did that, or 4 to 5 years. Emily's been gone.
You think it's been that long? Good golly. I mean, I remember it. I didn't think I was part of this group for that long.
Emily's been gone
I'm
for,
thinking
it'll be
3.
2. 3 would have been,
because I've been at Harvest for
COVID.
2 years this month.
3 would have been COVID.
Oh, it could have been.
Rhonda,
So
was
4
was
would've
that when
been-
you and Lori kind of deemed them as ambassadors or something, or what was that?
Leaders, yeah, weren't they something like that?
Yes.
Good memory, ladies.
So it had to be like 18 or 19. Isn't that scary? Yeah. So maybe we can find a small amount of funding somewhere. In fact, if we wanted to apply, well, we'll see what we can do to find some funding that might cover the cost of maybe a couple of focus groups so that people have the ability to participate. I know lots of people have the desire, but lack the ability if there's not an incentive. You know what I mean? Our time is precious, and if it doesn't align with your daily work, it's
Yep.
super hard to participate in these sorts of things. But if there's an incentive, sometimes people are willing to spend their own time to do it.
Hmm. We did that before. I was thinking what we gave
I
them
thought
$100 or something.
I'll have to go
200?
back and look. It was something. I'll have to go
That
back
would be
and look.
great. Yes.
Okay.
And
Okay.
everybody showed up for the 3 meetings. I don't think
Isn't
we
that
ever
awesome?
had. Hmm.
And for that little amount of money, do you remember how many people were there? Like 10?
Yep. I don't think anything more than that. But yeah, I think we had providers from both sides of the state line.
And centers and homes were
Yep.
representative.
Correct.
Okay, I'll go back and look and see what amount of money we spent. We can either look at applying for implementation funds to support that through the KCPA plan, keeping in mind that that interferes with Start at Zero's request. They've already requested the full amount, but that may be how the sector wants to move forward. Maybe it's not a full funding amount for Start at Zero. Maybe it's a partial funding for their request so that other things such as this can also be funded. And then we can, or maybe there's other opportunities for funding, but we can go from there if the group thinks that makes sense. Okay, so before we sign off for the day, I'd like to think about when the group wants to meet again. How often, and is there a day of the week, time of the day that would generally work for most? Like this happens to be the third Wednesday at 2:00. I don't know if that's a Chris, that looks like a hit or miss.
It is a hit or miss. Usually Wednesdays are packed. Yesterday, my Thursday was my Tuesday. Yesterday, my Thursday.
Yep.
Yesterday, my Tuesday. So I don't know, Shelley, if a doodle poll might help with folks, or I don't know. I never know how to tackle these beasts.
I know.
Unfortunately, Friday mornings always seem to be a little better.
Mondays and Fridays are better for me. Unfortunately, we don't have a lot of standing meetings except for a few. We have monthly meetings, but they're never consistent.
Yeah.
Monday mornings before 10:30, we have an admin call at 10:30 every Monday, but Monday mornings before that
Mm-hmm.
typically work.
And what about Fridays mornings? I mean, I can make that work too. Mondays and Fridays happen to be a little bit lighter for me as well.
Me too.
I have one standing on Fridays, but I can rearrange it based on this, especially if it's once a month. It's no problem.
Yeah, I don't think I have any standing on Friday. And if I can get something on a calendar and secure it, then hopefully people leave me alone during that time.
Oh, it's a plan.
Yeah. Tara and Lori, do you either of you have a preference or restrictions?
Nope. Monday mornings are hit or miss for me, but more often than not would be fine. Fridays mornings tend to be a little better, but like Chris said, it's hit or miss sometimes. It just depends.
But are we talking just adding a monthly? Yeah.
Don't you think? Again, we can do whatever. I'm
No,
sort of throwing that
I
out
think
there.
monthly probably would capture it, because I think if we try to do more than monthly, we're gonna run into a lot of situations like Tara said, hit and miss on a Monday, and that way not every Monday is captured by that meeting time.
Yeah, Mondays or Fridays work well if it's early, so then I can still get out the rest of the day. So nobody likes an early Monday morning meeting, but
Yeah.
it would
True.
work
That's
for me.
true too.
Well, do you think 9:00 is, I mean, that gives you an hour to get in and get? Yeah, we had lovely 8:00 meetings arranged by the people that are working on the registry on a Monday morning. I was like, are you flipping kidding me? But that was the
Yeah.
only time that, people are like, yeah, it didn't work out so well.
So it sounds like Friday might be the better day more consistently. Again, I don't want to put words in your mouths, but and I can make either work.
So I just want to throw out the fact maybe we put the one on the calendar for whatever Friday, but if we're really hoping to entice Amy to come over to the side and be maybe pushing that forward, then we may need to be a little more flexible with what she can do. So hopefully Friday mornings work out great for her and it would be ideal, but I think reality is if we want that to happen, we need to be flexible.
Excellent point. How about if we just set the next meeting for a Friday morning? And as we reach out to Amy and see what her availability is, we can either adjust that, whether it's move it to a Monday versus a Friday, but we'll get a little more feedback from her. But I always think it's having something on the calendar is always helpful. Okay, so let's see. Okay, so I hate to put a meeting on Friday, March 17th. Because I think that's setting us up for either being off on spring break or for St. Patrick's Day. So how do you feel about the 10th of March or the 24th of March? Any
I
preference?
prefer the 10th myself.
Okay.
10th is Conference of the Young Years for Missouri side. But, you know, if it works for everybody else, you know, certainly don't rearrange it for myself.
Are
Well, does
we,
that mean Lisa would be there too?
I think Lisa's presenting, so
Okay.
Lisa would be there. I'm unsure if maybe Chelsea or who else on the Missouri side, but I know Lisa is presenting.
Okay.
I don't have to have the 10th. I was just throwing that out there. So 24th it is.
are we talking about a morning meeting?
Yes.
Good, because I'd much prefer a
But
morning.
that will be the day after our early childhood sector meeting, won't it?
1, 2, 3, 4. It sure would.
Do you think that's a problem, Lori, or do you think things will be fresh and we can just kind of bounce again?
Flow from one right into the other. I'm not objecting to that. I just wanted to
Yeah.
point out that there may be.
Yeah,
We could always go to the 3rd. That's 1, 2. It's just 2 weeks from now.
Which is the day after the quarterly
Mar-
for the
Yes, but
big
that's
group.
not a problem for us.
Okay.
We're fine with that. I mean, so do you have a preference, the 3rd or the 24th?
if we do the 3rd, I have something from 10 to 11, but I can do 9 to 10 or 11 to 12. Or 7:30 to 8:30.
Woo! Ouch.
Chris, what are you talking about?
Seriously.
Just see if y'all are alert.
I most certainly will not be.
Yeah. No, I would not be either. Any preference?
I'm almost leaning towards the 3rd because we're kind of getting going, and if we can bring those other folks on, we can start engaging them, and we're not having a huge lapse of time and let things drop off.
I think that makes sense. Okay, so let's shoot for the 3rd from 9 to 10. And really my goal would be that we spend no more than an hour. I mean, and today we're a little over 45 minutes. But once we have our meeting times already set, I think if we can get a good 45-minute meeting in, and then the 5 minutes with reviewing next steps to make sure we're all on the same page and everybody knows what the goal is, then we can make sure these stay efficient meetings with a purpose and on track. Keep moving forward. Okay. Well, great. We'll get this information sent out. We'll do our follow-ups And then we'll share this information with the broader group at the early childhood sector meeting on the 23rd. So we can invite additional people to participate if they want to, and then we'll go from there.
Sounds great. Thanks,
Okay.
everybody.
Yeah, thanks everybody.
Thanks. Bye.
Great to see you all.
Bye.
Have a great week.
Bye.
You too.